I'm Emily Murnone. I work over at OSU East Hospital as an assistant nurse manager for the observation floor. So we have vein finders on nursing units. It helps us visualize the veins using a light on patients' arms. That way when we're doing blood draws or inserting IVs, we're able to get first stick, ideally. The issue is those tend to get dropped because they're used so often. When they get dropped, then they get broken. And if they're broken, they're out of commission. We can't use them on patients until we get a new one. So when there is no vein finder on the unit and it's difficult to get one, it's hard on the patients because we try to do the least amount of pokes for blood draws and IV sticks as possible. So if you don't have a vein finder, you're just going kind of old-fashioned feeling and looking. Using that vein finder really helps you pinpoint where you need to go.
And one year I did replace 2 of these devices, which was over $10,000. Collectively, the medical center, in 10 months, actually replaced devices that cost over $130,000 with this particular company. When reaching out to the company, we discovered that there were no protective devices to actually cushion the impact to prevent any further damage.
We thought about video game controllers, how if you throw them against something by accident, if you're playing with them, they have coverage on them, the silicone sleeves.
Emily is my assistant manager, and Emily said, there's an innovation studio, we should really take this idea. She took it to the innovation studio. We then partnered with Josh at the innovation studio.
I actually brought the idea of the innovation studio through a PowerPoint with a picture of the vein finder device and me drawing something on top of it with just like a rudimentary sketch.
Most commonly when people walk into the innovation studio, they've got this idea that we call a napkin sketch, and I try to have conversation with them and talk to them about what this idea might be and how we can actually make this tangible.
What this does is it protects it, so whenever it falls off a bed, whenever a staff member might accidentally drop it, it provides that cushion so we can eliminate the cost of refurbishing or obtaining a new one, which can be costly.
To make their project, we use an analog injection molding process involving creating 3D printed molds that we injected silicone rubber into. From there, we demolded those molds and produced the hollow sleeve that fits over the device.
Our dream for the product was to design something that's going to save the product from being out of use and provide patients with that better care and have access to better equipment to care for our patients.
The Innovation Studio is a great place to kind of take those workarounds you do on a day-to-day basis, whether you're a nurse, a doctor, you encounter a barrier, you think, oh, I'm just going to do this quick fix. You can actually take that quick fix and change the future of healthcare. You can make your idea into something that can be used across the world, possibly.
We bring together these interprofessional teams of experts in all different fields from across campus to do something that no individual person could do. And then as a team, we produce these positive results that make an actual, tangible impact in the lives of people around us.